Hey there, my name is Jim. If you have found this video, then probably you've been doing some research on back pain or back surgery or lumbar pain or lumbar discectomy or something like that, sciatic pain, nerve pain, and you've come across this video. What this is the second of two so far, and what may end up being 3, 4, 5 videos, and it's detailing my journey from the first moment of feeling pain all the way to where I am right now, 10 weeks later. And later videos will probably focus more on the recovery and rehab process. The first video detailed kind of the first month from when I first started feeling a slight pain in my right upper butt until around Thanksgiving, and what happened then to sort of gum up the works a little bit. What I'm going to do in the second video is I'm going to kind of start from where I left off in the previous ones. If you want to look at that, you're going to have to go to my channel and kind of look that up. But I'm going to start with what happened the day before Thanksgiving, and then how that led into the decision I finally made about what to do about this pain. So as I mentioned in the first video, I had been experiencing some serious nerve pain that had me down flat on my back. I'd been through the emergency room, I'd been to chiropractors, I'd been to my physician, who finally decided we needed to get MRIs done to kind of find out what was really going on, and then to probably consult with a neurosurgeon to kind of see, depending on what the MRI showed, see what we need to do about it. So the appointment, I first started feeling back pain, the nerve pain, in the late October. It put me on my back November 8th. November 23rd is the first chance we had to get in and get MRIs done. So the night before the MRIs, I started feeling some abdominal pain that I thought was related to the nerve pain. But the morning of the MRIs, it was a little worse. My wife suspected something else was going on. So we worked it out to where she called my doctor called them, we set up a CAT scan, and the CAT scan unfortunately showed acute appendicitis, and so my search for what to do about nerve pain was temporarily derailed by an emergency appendectomy the night before Thanksgiving. And it kind of slowed things down a little bit because I couldn't go anywhere for a couple weeks, 10 days, whatever, while my appendix stuff was healing up. But we were able to go ahead and get some other things scheduled. Now, the reason I brought up the appendix thing, besides the fact that it derailed my process a little bit, was that during talking to the doctors who were involved in the appendectomy, kind of helped point us in the right direction, strangely enough. We just weren't sure what to do, who to talk to, whatever. But the anesthesiologist saw me walking to go to the bathroom before my appendix surgery, and he told my wife, "Oh my gosh, that's not just a little back pain, that's a nerve problem. He's got a nerve compression." He says, I've been around this a lot. I've done a lot of work with doctors, with neurosurgeons, and that's a nerve compression. Now, maybe he was just blowing smoke or whatever, but it turns out he was quite right. And he had given us the name. He said, "Don't go to these kind of people. Don't go to these kind of people. Here's the guy." And he gave us 3 names. And I'm in Texas, and it was at the Fort Worth Brain and Spine Institute. If you happen to be here, that's the people to talk to. But he gave me the name. He said, "My top choice is this guy." So after the appendectomy, while I was healing up, my wife got in there and she started making me appointments, and we got an appointment with this neurosurgeon. And we went and talked with him for a consultation once my appendix thing was healed up enough for me to go down there. And he talked to us about the conservative treatments, which would have been spinal injections to sort of take away inflammation and reduce the pain and kind of make you functional for X length of time. And that seemed like a decent possibility, but I was like, what the MRI showed was that a disc had completely blown out. at the L3-L4, and these shots weren't going to fix it. They would just mask it, basically. There's benefits to just masking it, don't get me wrong. But I was like, what fixes it? And he said, well, surgery is what fixes it. So then he went on to detail kind of what the surgery involved, which is make an incision. I'll put a link to a video and you can watch the whole surgery. But basically, you make a incision, you grind down in there, you create a surgical field, you start clearing away tissue and stuff till you find the nerve. You pull the nerve aside, you pull out the disc, and then you clean it up in there and close it up, and voila, you're done. This all sounded really cool until we started talking about kind of like the rehab, and I asked about I had just done like 15 sprint triathlons over the summer and leading up to this, and so I asked him about running, and he said, well, probably no running for probably a year, if then. And that was very disappointing. And then he also mentioned the risk that went with the surgery. Well, there's a 5% risk that we could hit a nerve. Well, what happens if you hit the nerve? Well, then you're permanently disabled in that in that leg. It is like, ah! So I was very depressed about that. But in the week or two, we went ahead and set a surgical appointment because the next appointment was available within a couple of weeks. After that, it was two and a half months away, and I didn't want to be in this pain for 2.5 months. So we took the surgery appointment, but we went on and got a couple second opinions and stuff on the pain management and all that stuff. The pain management person said, I think you probably ought to go in there and just get it cleaned up. Don't worry about that risk factor. They have to say that, but he's been doing this for a long time. He's really good. He'll get you fixed up. So it's like, okay. But honestly, one of the things that helped me most was a video. And like I said, I'll put the link for it down here. Was the video showing the surgery. I watched the surgery and I thought, well, they could do that. I can handle this. This will be good. And so I went ahead and chose the surgical route because I just thought for me, that the conservative treatments were going to just mask the pain and mask the problem and not fix it. And I really wanted to try to fix it. Now I'm a little older. I don't want to mess around and waste time, so it's like, let's go do this. So we set the surgical appointment. We kept it. And let me just tell you for a second, it was never like my back that hurt. I could bend over and all kinds of stuff, but the pain was, the compression of that nerve was sending massive pain down through my butt and down my leg. My leg was numb. I was feeling pain in the quads, part of the hammies, the adductor muscles, if you know what that is. And my leg was numb. It was weak and it was buckling all the time. So anyway, that's just to let you know kind of what my pain was doing. And the pain was through the roof when it was at its highest. Like, what's your on a scale of 1 to 10? Well, it's a 12. Thank you. So anyway, we chose the surgery. We did the surgery, and in the recovery room, once I woke up and got my wits about me, they need you to stand up and walk, go to the bathroom and stuff before they'll let you leave. So I stood up and walked to the bathroom, and the one thing I noticed was I couldn't tell whether there was pain or not, but what I could tell was my leg felt like my leg again. It felt like it was like sort of under my control again. It was weak, but I was encouraged because I was able to kind of walk and it didn't really hurt all that much. Now, I'm going to go ahead and end it here because we're already at 9 minutes and I don't want to go any farther than that. But the next video, I'll talk about kind of what happened from the time of the surgery on December 20th to where I am now, which is middle of January. And I just started physical therapy this week, and I'll kind of let you know kind of how that process has gone for me. And I had 2 friends who just recently had a similar surgery. One of them chose surgery immediately. The other ones chose the conservative methods. And I'll kind of talk about those a little bit and tell you how my rehab has gone so far. And hopefully it'll kind of help you in the whole decision making process. And okay, so I'm going to cut it off there and see you in the next video. Thanks.